Good evening, one and all. My name is Dr. Bimal. On behalf of Indian Veterinary Association and World Ayurvedic Foundation, we are conducting the 7 days week-long international online workshop on globalization of veterinary Ayurveda. So today is the 6th day of our this lecture series, and tomorrow we are concluding it with a panel discussion. Without further delay, I would like to invite today's moderator, Dr. Nivedita Nayak. Dr. Nivedita Nayak is a veterinarian. She has completed her BVSc from Odisha University of Agriculture and Technology and her master's from Madras Veterinary University, and she was pursuing her PhD at IVRI. She got through ICR ARS recruitment examination and was selected as a scientist. Now currently she is working as a scientist in poultry science at ICR CCARI Goa. I request Madam Nivedita to moderate today's session. I also invite today's speaker Dr. S. Kumar and Sri Ravi Singh Chaudhary. Over to you, Madam.
Yeah, thank you, sir. Very good evening to one and all. I welcome all of you to this international online workshop series. And
Yeah, Dr. Nivedita, can you just turn on our video?
Yes, sir.
Yeah.
One second, please.
Yeah.
So I welcome one and all to this international workshop series on veterinary Ayurveda about globalization of veterinary Ayurveda in recent times. And today we have two speakers for today. First speaker will be our esteemed Professor Sri Ravi Singh Chaudhary from Jharkhand, and the second speaker will be Dr. S. Kumar, scientist in Transdisciplinary University, Bangalore. So I will welcome Dr. Ravi Singh Chaudhary sir for his speech on Pashu Ayurveda in Agni Puran and Vriksha Ayurveda practices in farm. So before starting, I'll introduce our speaker of the today. Ravi Singh Chaudhary is a Vriksha Ayurveda best agri-trainer in Jharkhand, and he has authored two books like Krishi Sahita and Gau Sahita, which is very important and bears practices and helps many farmers in their farming practices also. And he has also published a paper on decolonization of the mind. Then basically, he is a mechanical engineer by education from Beach Sindri, who has devoted his whole life to the Bharatiya Darshan, which is quite exciting and exploring ancient sciences. So his efforts and different determination in pursuing ancient sciences in modern times is very encouraging, and I hope all are eager to listen him. So I welcome Dr. Chaudhary for giving his presentation on Vriksha Ayurveda and Pashu Ayurveda. Please, sir.
Thank you so much for inviting me here. It's a very that I am saying lot name with doctorate degrees. So I am just an entrepreneur. I have no PhD, but I have few years of experience of applying Vriksha Ayurveda technique in our farms. And also after the attack of lumpy virus, we moved to using herbal medicines like from Dr. Who, like aloe vera in lumpy virus. Topic. We have Ayurveda for human. But for Agni dosha, pitta dosha, and kapha dosha for the but I found
I
So
think
not hear you, sir.
some network issue. I think let him join again.
Okay, sir.
I think there was some technical issue. Okay. Am I audible right now?
Yes, yes. You can continue, sir.
Yeah. Okay. So now the third shloka that mentioned about
Ravi,
fumigation technique, like use
one
of
second.
Vach, Jatamansi, Devadaru, Gugul, Sarshap.
Ravi Singh, excuse me.
These are very much elaborative and using the word Vat, Pit,
1 second,
Kaph,
sir.
and also suggesting like preventive care in the Gaushala. Okay. So it
1
proves
second,
like,
please.
yes. Yeah.
Yeah.
Can you
Please,
just
doctor.
Your voice is
begin from
not
the
coming,
start?
ma'am. Nivedita, ma'am.
Dr. Ravi sir, can you start from the beginning because we are not able to listen you from the beginning. Can you just start from the first slide? I couldn't hear you actually from the first slide. There was some technical glitch.
So I was just mentioning about few shlokas
No.
from the Agna Purana. Now I am
Sir, go to the first
practitioner of
slide, sir.
Vriksha Ayurveda technique, but I have found some shlokas on Pashu Ayurveda. That's why I mentioned here. Technically, I'm not using those techniques for our cows in the dairy, but still we have used like turmeric plus aloe vera in the lumpy virus issues. Okay. Also the use of moringa leaves for the preventive healthcare. Now, the main topic of today's is the Vriksha Ayurveda. That's what I'm here to tell you about. So, what is this subject is all about? So, in today's time, we study everything in very compartmental manner. When we do specialization, we have to leave the subjects, or we have to go for cross-disciplinary understanding to get the proper understanding or wholesome understanding of what's happening. So Vriksha Ayurveda is the combination of agriculture, botany, agri-meteorology, plus soil sciences, and again the ecology. So in agriculture, the one of the recent technique of natural farming is like permaculture and agroecology, agroforestry. These are the things like do nothing agriculture. You have to leave cultivation, use of tractors, use of fertilizers, or even use of the pesticides. So you have to imitate the forest, or you have to go for the rules of ecology, avoid monoculture, create an ecosystem that will enhance or give productivity to your crops. Okay. So these are the most recent development in the agriculture. But what Vriksha Ayurveda is telling, like it is already saying, like if you are doing agriculture, you have to take care of all other these sciences. Okay. And what is the prerequisite? Again, the basic knowledge of Dravya Guna. Okay. So, and yes, Jyotish Shastra, like in biodynamic agriculture, we go for the lunar cycles, we go for the arrangement of how the nakshatra constellations are going. So even the planetary positions are considered in Vriksha Ayurveda. So in modern biodynamic agriculture, okay, biodynamic agriculture is a very famous and it is being practiced throughout the world. So it is also using the techniques of, you can say, astronomy. So this is the subject, Vriksha Ayurveda, plant life sciences, Vriksha Nam Ayurveda. So as per definition of Ayurveda, when we go for the human, it is not just taking care of the symptoms or the disease. We say कि हमें शतवर्ष 100 years of life human की achieve करनी है and quality life achieve करनी है. We are improving the lifestyle of a person, not just curing for a disease. So similarly, if you go for the Vriksha Ayurveda, it is like we are talking about the productivity, better plant life, better quality of the produce, not just the yield. So in agriculture, we emphasize more on the yield part, production part, but Vriksha Ayurveda is taking care of all the quality issues with what modern agriculture is facing. So the Panchabhuta concept is being used here in Vriksha Ayurveda, and we understand what is Vat, Pitta, Kapha. It's a combination of Vayu and Akash is Vata, a combination of Tejas, that is the Agni, and the Apas Jala, that is the Pitta, and Apas Prithvi is the Kapha. Now at the microscopic level, we go for plant cell and animal cell, and we see there is very, very few differences at the microscopic level. Okay, so using that framework or applying the Pancha Mahabhuta framework, we can go for like, okay, we can also use the three dosha understanding for the plants also, and they are also the living beings. So these are the cause of problems, either disease, nutrition issues, pest attack, that is the insects, sudden change in weather, and the three dosha effect, like over irrigation. Obviously, it is the kapha dosha for the plant, over irrigation. So understanding of a care of a human, like a use of triphala or use of many of the technique, we can also develop those techniques for the plants. And we have 325 shlokas in Surupala Vriksha Ayurveda, 325 shlokas. Okay, and one of the famous shloka that is mentioning about Kunapa Jala. Kunapa. Kunap is foul. In Sanskrit, foul smell. That is the fermented solution. So this is the solution that is being used again and again in not just in Shurupala Vriksha Ayurveda, also in Chakrapani Mishra Vishwa Vallabha. Okay, that is also a text on Vriksha Ayurveda. Brihat Samhita of Varahamihir, that is also mentioning about the Vriksha Ayurveda. We have not just not kind of an elaborative text, but telling about agriculture, that is the Krishi Parashar, Kashyap Krishi Shukti. Okay, so this is the ingredient of the Harbala Kunap Jal that is being developed in Pantanagar University and also by the Asian Agri History Foundation. So these 10 ingredients are being used. I will show the video also, like how we are preparing it in our farm. So if you are aware of like Jivamrit, zero budget natural farming, Subhash Palekar, any of these words, if you have heard earlier, you know about natural farming. Okay, so you see in Jivamrita, Amrit Jal, Amrit Pani, these are very frequent terms that is being used throughout India in natural farming. They use what? Cow dung, cow urine, jaggery, basin, soil beneath the bargad or peepal tree. So I had curiosity, like from where these things are coming. Okay, like preparation of this Jivamrit and combination in a fixed proportion. Okay, so the Kunapjal is answering all those questions. Like fermentation is the technique of Vriksha Ayurveda. So we have used 10 kg of cow dung, 15 liter of cow urine, jaggery 2 kg sprouted urad. Okay. Oil cake is either you can use mustard, neem, karanj or sesame, whatever is available to your local region. Boiled, cooled and filtered rice husk water. Buttermilk 2 liter, milk. Now chopped local weeds. And again the water to fill the 200-liter container. Now, you see, this is not a kind of a solution that one fits for all, because we have varieties of oil cakes that can be used and chopped local weeds. One of the problem of today's agriculture or the farmer is facing like weeds problem. Now, dairy and farming, those two become two different kind of business. Okay, dairy are using ready-made bought feed, okay, mineral mixtures, and in agriculture we are very much concerned with the weeds. That's why using herbicide. Now you see, natural farming or the dairy, if we observe closely or monitor it, we say a lot about green fodder. Okay, green fodder in dairy, and we use mulching technique in agriculture to suppress the weed growth. Now, the cow dung, it is beneficial for our farm, and the weeds that are growing, that are the actual green fodder that can be used for the cattle. So if you go for sustainability, the Vriksha Ayurveda and Pashu Ayurveda should be combined, and what we say in today's term, integrated farming. Now, these terms are very much kind of a sophisticated, but Indian agriculture was always integrated. It was monoculture that disturbed the conventional agricultural practices in India. So you see, chopped local weeds can be used to make fertilizers. Okay, weeds are like they mine the nutrients, and subsequently the main crop goes for lower yield because of weeds. Now weeds, because they mined the nutrients, we are putting back those into soil using the fermentation technique. Now let me show the video of how we are preparing it in our farm. Yeah.
Raviji, I think you have to stop the screen sharing, then only you can play the video.
Yeah, these are the plant wonders that I found in Vriksha Ayurveda text. Out of season fruiting, prolonged fruiting and flowering, converting a tree into a creeper, changing the aroma, seedless fruit, dwarfing a plant, recovering sweetness of the fruits. Drip irrigation, it's kind of a pitcher irrigation, not a drip irrigation, but pitcher irrigation, drop wise. Hailstorm impact recovery. That's what, that is the slok that I got amazed and surprised, like we have such a elaborative methodology to recover something that is we call hazard. Okay, hail storm impact recovery. We are seeing lots of effect of climate change in our agriculture. Now these things are these shlokas can help us. So that is the indigenous technical knowledge ITK that we want to understand, and we have to use it for our farmers. So you see, it is not a very much uh, uh, foundational text. It is very much descriptive, elaborative, and very much advanced as per the timeline that we understand. Like Shurpala Vriksha Ayurveda is more than 1,000-year old. Okay, so these are the plant wonders, and these are two two books that I have written in Devanagari script for the farmers. First one is more focusing on Vriksha Ayurveda. Few of the shloka, it is not a academic book. It is kind of a manual for the farmer. So other practical natural farming techniques are also there, and the Gau Samhita is also mentioning about the ethno part. It has one of the chapter from my village. Okay, what my ancestors used to do. So these two works I have done for 5 to 6 years, and I have used these techniques with the farmers only. So I have not did the dissection of these techniques, simply what is executable, what is easy to use for the farmer and has practical utility, that those techniques I have used with the farmers. So this is the uh, video from one of our farm. Yeah, let me share this sound also.
Ravi sir, are you there? Hello.
Yes, sir. I think he's existed maybe. He's not here.
Dr. Bimal, I think there is some net problem as well as some technical problem that he is not able to share technically. So better to go on slides. Please tell him not to show the video.
Okay, sir. Ravi sir, are you there?
He's being cut up while he's trying to share the video. He's being cut up. There is some connectivity problem. Better to describe and to speak and to show some slides if possible. I think time will save.
Yeah, yes, sir, yes. I'm just calling him. Yeah. Ravi sir, are you there? Okay.
Yes, sir. Please call him and he can join again.
Yeah. Meanwhile, I think we can start with our second speaker. We can take the questions later. Padi sir, what is your suggestion?
Yes, better to
Yeah,
go for second.
yeah. That will be better.
Dr. Kumar, are you there?
Yeah. I'm here, doctor.
Where? Just tell me, I will make you the co-host. Okay. Yeah, I just made you co-host.
So I can share my presentation.
Yeah.
Is my presentation visible to all of you?
Yes, sir.
Is my presentation visible?
Yes, sir, it's visible.
Yes, sir, visible.
Okay. So
Sir,
great. Good evening. Shall I start?
sir, I will just introduce you.
No, sir,
Okay.
we will introduce you properly. Can you just, can you stop for a moment? Then, after introducing, start.
Sure.
Yeah, very good evening, sir. I welcome you for this international webinar series, workshop series on veterinary Ayurveda. And sir, we are very fortunate and privileged enough to have you here in this platform. So, and I will just, you have many feathers in your cap. I'll just give a brief introduction for this. So for all the participants, so Dr. Kumar SK is a scientist E in the Center for Ethno-Veterinary Science and Practices in the University of Transdisciplinary Health Sciences and Technology in Transdisciplinary University, Bangalore. As we know all, he has an MD degree in Ayurveda Pharmacology, and then again he has a PG this year in Clinical Research from UK, and the PG DOS, that is a Diploma in One Health from Kerala University of Veterinary and Animal Sciences. Currently, he's pursuing PhD in Transdisciplinary University on the subject of antimicrobial resistance and Pashu Ayurveda. So he worked in the area of experimental research on Ayurvedic medicines, such as in vivo and in vitro for drug standardization. He also worked as technical advisor for the pharma industry for development of formulation for clinical application. And in 2019, Sarah joined TDU as a part of a team for documentation, assessment, and promotion of ethno-veterinary practices. And Sarah is also involved in development of curriculum for postgraduate diploma in ethno-veterinary practices and certificate program of EVP along with Tanuvas Chennai. He is also part of a group promoting veterinary Ayurveda through training veterinarians and farmers in South India, as well as a part of Europe and Holland and Portugal mainly. So his works based on to reduce the indiscriminate use of antibiotics and veterinary drugs. He also developing and establishing the principle of Ayurveda in veterinary practices, and is also a pioneer in Mrug Ayurveda. Sir is having more than 10 publications in national and international journals. He has organized 5 international conferences on veterinary Ayurveda already, and having 18 years experience in authentic Ayurveda practices. He has many international exposure and visited many countries, including Bolivia, Portugal, Germany, Holland, Switzerland, to deliver lectures and speech on veterinary Ayurveda and ethno-veterinary medicines. Also, he has published books on medicinal plants and primary health care of farm animals in different languages, which is very beneficial to the farming community as well as to the academicians also. Sir has delivered hundreds of lectures on veterinary Ayurveda for different stakeholders in animal husbandry. Followed by Sir is the National Committee member to develop curriculum on Pashu Ayurveda and EVP, honorary advisory member of Indian Veterinary Association, also advisory member to Romania Ayurveda Society, and advisory member to the School of Ancient Wisdom. So, think this, sir, we are very fortunate enough to and eager enough to listen to you. So, I welcome once again, sir, to this platform. And we all want to listen on Ayurvedic understanding of disease diagnosis and its management, mostly mastitis for today. Please, sir, you can start now.
Okay, thank you, Dr. Nivedita, for in detail introduction of myself. And I thank Indian Veterinary Association and World Ayurveda Foundation for inviting me to deliver a lecture on the subject of Ayurveda understanding or Ayurvedic understanding of disease diagnosis, very specific to the mastitis and its management, how Ayurveda understand as a disease then how specific Ayurveda can understand a disease mastitis in animals to say. And as a series of lectures on behalf of Dhanvantari Jayanti, we are here to celebrate a week of webinar series. As a part of it, I'm very happy and fortunate to be here and honored to say. So I'm Dr. Kumar here. Next 15-20 minutes, I'm going to deliberate on the subject of basics of Ayurveda understanding in specific to animal applications. Is my slides are moving?
Yes, sir.
Yes, sir.
Okay. So before taking you into Ayurveda for animals, I just want to brief you all on the principles of Ayurveda. See, Ayurveda is a comprehensive system with holistic approach to say. So it talks or it works on 5 elements theory, and which is also can understand correlate on atomic theory of cellular formation, and 3 humors theory, physiological entities for cellular function, and 7 tissue elements which are responsible for anatomical configuration to support the body, and 3 waste material which helps in understanding cellular and systemic metabolic pathways, outcomes, and its excretions. To say principles, all the principles from Ayurveda point of view is based on this, and over on above on this, all the drug and its action can be considered. So when we understand 3 humors theory, it can be indicative or correlates to the dosha with the biomedical science to say what exactly the Vata, Pitta and Kapha is all about. When we say Vata, Pitta, Kapha, everybody have a confusion and everybody question how we are going to measure, how we are going to explain what is Vata, what is Pitta and Kapha. When we say on the biomedical science, it is clearly explained to understand in the literatures how Vata functions and how Pitta functions and how Kapha functions in the body. Example to say Vata, any movement in the body is through Vata. Any governing nervous system or muscular system is through Vata, and any signaling pathways, in regulating the cell growth, differentiation, and cell death is through Vata. That means whichever, have the movement, whichever have the communications are through Vata, and the transformation is through Pitta. To understand any actions of the enzymes, any hormonal factors, any process of digestion and metabolism or energy production or energy utilization is completely carried out through Pitta. Similar, the function of Kapha to say anabolic activity, which maintains the body and starting from its mass shape to the flexibility and its its functioning entity through biosynthesis of macromolecules to the micromolecule through gene and its productions of protein functioning capability through Kapha. That means to say we can easily correlate the Ayurveda understanding with the biomedical science, how the physiological entities of Tridosha or 3 humor theory help us to understand for its function for day-to-day business in human as well as animals. So that is a one side. The other side of understanding about the entities or the principles of Ayurveda is elemental tissue, the dhatu, the factor which are responsible for maintenance of health when it is being aggravated or when it is being intervene with the factors of disease pathogenesis, then it can lead to a disease. That is the 7 tissues which is also called as saptadhatus in the body, starting from rasa to shukra. What is this rasa is all about? That is the fluid component. It can be intra or extracellular, which nourishes the body. Then next is the rakta. We call it a saptadhatu, rasa, rakta, mamsa, meda, asti, majja and shukra. And one leads to the formation of the other. The first dhatu or the tissue is going to form in the body is the rasa, and followed by the rakta, mamsa, meda, asti, majja, and last the shukra dhatu, which is being supported by all other 6 dhatus. So rakta is the intravascular component, gives the life to an individual. The mamsa is the muscular tissue which covers the body for its functioning. The meda is the adipose tissues which lubricates the body. Then the asti is the strength component, which is also called as systems, which supports. Then the majja is the intra-osseous material which completes in skeletal system. Then at last the reproductive system or the material is the shukra which reproduces, which covers all the tissues. So first is the Tridosha theory, and the second is the Saptadhatu theory, which is very important for us to understand on the principle. Based on this principle, we will understand the disease pathogenesis. See, this slide will help you to understand what is the cause for a disease or cause of a disease as per Ayurveda. See, every minute, every second, our body has to undergo metabolic process. Because of change in the metabolic pathways or metabolism, then there can be an aberrant metabolism can happen to anyone or to any animal that leads to the formation of ama or the toxic, which is considered as pro-inflammatory waste products from modern point of view. We call it as hama, and that leads to blocking of the microchannels which are responsible for physiological functions. Then it leads to a disease. That to say, because of the aberrant metabolism, there is a formation of hama. Because of the formation of hama leads to srota avarodha, that is the blocks the microchannels, and because of that, disease is going to form. This is the basis for understanding disease pathogenesis in Ayurveda. Then, how we are going to understand the diagnosis in Ayurveda? It's clearly explained in the literatures of Ayurveda. There are two ways of dealing in diagnosis of the disease. One is the Rogi Pariksha, examination of a patient, and is the Roga Pariksha, examination of a disease. Both are very important in using as a tool for better diagnosis. So when we diagnose through examination of patient, it is classified into three, which is called as three pillars of diagnosis. One is the Trivida Pariksha, that is 3 types of examination in a patient. Then Ashtasthana Pariksha, 8 places of examination in a patient. Then Dashavida Pariksha, 10 parameters of examination for conclusive diagnosis in a patient. Then what we are going to diagnose or examine a disease. The disease examination will go through this process. One is the cause, second is the premonitory features, then cardinal features, and then differential diagnosis and the pathogenesis, which is called as five bases for diagnosis of a disease or Roga Pariksha as disease examination. Then coming to the Trivida Pariksha of a patient, first we call it as a Darshana, that is an inspection. Second is the Sparshana, the palpation, and the Prashna, interrogation. All these are applicable for human, for animal diagnosis. First we need to see the animal, then we need to touch or palpate the animal to understand more about variable at the anatomical and the physiological factors. Then we got interrogation with the farmer to understand more about diagnosis. Then 8 places of examination to have conclusive diagnosis goes like this. The first is the pulse examination, Nadi. What we understand through Nadi, variation at the physiological entities, which clearly make us to know more about the cause for the disease and the status of the disease. Then the tongue examination, urine examination, stool examination, then the sounds in the body, which help us to have a better diagnosis. Then examination by touch, that is sparsha, palpations, then examinations of eye of the animal or the human, or to say a patient, then physical stature or stature of a patient, akruti. These 8 helps us understand the status of a disease for conclusive or better diagnosis. Then 10 parameters of examination, Dashavida Pariksha we call it as, which supports for our diagnosis. So these are the 10 important parameters. First is the body constitution. Every individual have special constitution to say. Based on that, we need to understand whether the individual is a diseased or healthy. Then Vikruti, based on that we can say or we can compare whether the individual is healthy or unhealthy. Healthy individual is considered as a standard, and to compare with the standard we'll get to know whether the individual is attributed with the disease or not. Then quality of body elements, that is the Sara. As I discussed the 7 tissues, we need to assess the Sara of each tissue to know that whether the animal or a human is healthy or unhealthy. Then tone of the muscle, Samhanana, how it is being formed, how it is being placed, help us to know anatomical features of an individual for diagnosis. Then body proportions, it is clearly explained when we learn anatomy, each part of the body should be in a proportion manner. If it is disproportion, that help us to understand for diagnosis of a disease. Then acceptability, then mental courage, the sattva of an individual, then digestive capacity, then capacity to exercise or capacity of exercise of an individual, then at last the age is help us to diagnose a disease. So these are the important parameters of examination, which is called as Dashavida Pariksha for diagnosis. So why I am telling these are the bases or the signs or the pillars of Ayurveda way of understanding about disease, diagnosis and its pathogenesis. So Ayurveda clearly explain theory of pathogenesis, which is called as Shat Kriya Kal. It's having 6 stages of a disease, which is called as Shatkriya Kal, Sanchaya, Prakopa, Prasara, Sthana, Shamshraya, Vekta and Veda. In modern way of explaining those, we can call it as accumulation, aggravation, spreading, localization, expression and exacerbations. So until the 3rd stage, until the stage of spreading, we can reverse the disease. Once it is become localized, it is very difficult to reverse, only it can be managed. That means to say, until the stage of 3, it will be doshic level. Once it is become a dhatu level or the tissue level, it is going to be irreversible. Even in case of diabetes, once the Vaidya or the doctor can able to understand the disease at the level of the 3, then it can be reversed and patient will not be put it on drugs for lifetime. So we can reverse and we can manage or we can cure the disease easily. But when it is localized with the involvement of Dhatu, Agni and Hama, it will be very difficult, only it will be manageable. So what is the role of Vaidya here to understand the stages of a pathogenesis to reverse or irreverse? So, okay, once we could be able to reverse, then it will be very clear cut understanding about curing of the disease. If you to do, it's going to be a manageable disease. So that is the reason the diagnosis, the outcome, the treatments. Even it is explained long back in the literatures of Ayurveda to say, when you able to carry out your examination in such a way that at the stage of 3 itself you can reverse, otherwise you're going to be end up with exacerbation level, which is called as Veda. So when we understand the cause, when we understand the involvement of the doshas, when we understand the involvement of dosha with the dhatu, agni and ama, then you will have a better diagnosis and to know about the pathogenesis of a disease. So variables explained in Ayurveda disease management. So it is not a single disease, single entity. It is a multi-component, multi-entity is going to play a role. For example, with this slide, you could able to understand disease will have a cause, pathogenesis and symptoms and affecting factors. Then patient will have, as I mentioned, the Dashavida Parikshas will also play a role. Then both the Vadi or the disease and the patient give us a precise diagnosis. Then based on that, we are going to have a customized treatment protocol for every individual. It is not that generalized treatment. Generalized treatment is not at all helping to any individual. We need to understand more on the patient side. We need to understand the disease on the other side. We need to have a combination of both together for having customized treatment. That is Ayurveda, which is explained long back to go with that multi-component as responsible for pathogenesis, multiple approaches to be a part of treatment protocols. To say diet, lifestyle, medicines, therapies, counseling, others, everything is going to play a role in better management and better treatment outcomes. So that leads to a health. Our approach is totally a different. This is drug. This is like that we are understanding from modern point of view. It is not at all going to help either a human or an animal. So we need to have a customized treatment for every animal for better treatment outcomes. That is Ayurveda. Then Ayurveda talks about holistic therapeutics. That means it is not one-to-one. It is one to other and other to one. So our focus is on host factors rather than the disease factors, whole system rather than the target tissue, multi-drug therapy rather than single molecule, preventive and promotive rather than curative or manageable. So our approach is completely on the holistic side rather than single entity or going with the disease side. This is Ayurveda principle explained in the literatures. So what are the inherent strengths of Ayurveda or Pashu Ayurveda to take it It is customized intervention. Yes, one-to-one. We need to analyze the animal, analyze the patient separately based on the principles what I have explained so far. Then multi-component intervention is very much need for every individual, not just single drug or not just the diet, not just the lifestyle. Everything to be added for better treatment outcomes. Then a systemic cleansing, what explained in Ayurveda, that is Shodhana Chikitsa, is very much need now and then to purify or to get rid of the toxins produced because of the metabolic pathways. Very important for us to have better health. Then homeostasis or restoration of a balance is very much needed, not just treating a disease. Okay, after treating the disease also we need to have a restoration process. For that, our tissues, our physiological entity has to come back for its better functions. Then apunarat bhavatva, that means that disease should not relapse. That it should be the approach of treatment protocol, not just to say that disease is cured, you need not to worry. Then the next important for us to understand is our treatment should not lead to the side effect or creating a one more disease in the body. That should be the standard treatment approach to have every physician for having better outcomes. Otherwise, nowadays, if you give drug for one disease, you're going to get the other disease because of that drug. So that is not the standard treatment. The treatment should be yonyam anyam udiriya. That means homeostasis should be maintained. That should not disturb the system, leading to other disease. These are the strength of Ayurveda or Pashu Ayurveda treatments. When we understand from modern point of view, that types of drug action are based on these. Either drug can stimulate or depress, irritate or replace, or it can be an anti-infective or modulation of the immune status. This is the 6 ways of drug or types of drug action attributed from modern way of understanding. Whereas indigenous pharmacology or Dravyaguna Shastra of Ayurveda explains in a different way. Drug can also act by rasa, that taste. Drug can also act by physicochemical property, that is guna. Drug can also act by the potency, that is virya. Drug can also act after its digestion, that is vipaka. Drug can also attribute unique physical activity, which is called as prabhava. This is the base of Ayurveda pharmacology, and based on this, every formulation is being formed. So how we are going to understand the pharmacodynamics of Ayurveda based on these 6 points? The effect so produced is action. That means every drug has virtue of its action by nature of the formation of the drug. That is inherent quality of a drug, herb available on the earth. So to say yat kurvati tat karma, the effect so produces the action. Then ena kurvanti tat viryam, that is factor responsible for manifestation of effect is viryam. We as a potency, I'll say how potent is the drug you're using. That means when you see the effect in the body, they call it as highly potent. Then yatra kurvanti tat karanam, the where, which part of the body the action is being. So that is the location, that is called as adhikaranam. Yada kurvanti sakalaha. Whatever we give, time is the factor which has to heal. Example, even for action of the drug, it takes 15 minutes. That's a kala. Sometimes without giving anything, time heal by itself. That is also kala. That means even that is a healing factor for all of us. Then yada kurvanti sa upayaha, the mode of administration, through which mode you are giving, that also help in for its action. Then yat sadhayanti tat phalam, that means the accomplishment is the achievement. At last, whatever the achievement we are giving or getting is the accomplishment. So the outcomes of the treatment is depending on these action by the pharmacodynamics of Ayurveda for medicinal plants. So when we think about the action, we think about the taste of a drug. As I mentioned, we have a taste. All the taste have the properties to give or to have action, and all the tests are made out of Panchamahabhuta. Based on that, the drug is going to attribute for its action. So when I'm saying homeostasis, complexity of disease management, then we look for what exactly the other homeostasis, because I'm going to talk on the mastitis, how mastitis disease is understood from modern point and how mastitis is understood from Ayurveda point. Everything we need to understand on the homeostasis, because it's not a single component or a single entity. It is a multi-component, multi-entities are playing a role for better treatment outcomes. When you see the udder, See, you can see invading microorganism to management practices, then comes with the understanding about the it is not a single entity here. It can be immune responsiveness from the animal. It can be a parity of the animal. It's stage lactation and anatomical character of udder. And again, coming to the invading microorganisms, it can be virulence factor, triggering pro-inflammatory factors, and management practices also playing a big role here to understand for management. So housing condition, milking hygiene, and nutritional management, stress. Ayurveda clearly explains any disease pathogenesis can be through these three important factors: ahara, vihara, and vichara. Ahara is the nutritional factor, vihara is the where we are living and how we are living, and vichara is the what psychologically we think every minute play a role. That means it is not a single component, it is a multi-component. Our treatment protocol also should be multi-components rather than drug-based, drug-driven management. So when we say about homeostasis, this is what I explained about swasthya, or balancing out our system. See, this is a complex picture, make us to understand. It implies balance, equilibrium, homeostasis of physiological functions, homeostasis of anatomical structures, metabolism, body tissue, excretory function, sense, mind, soul. Everything, every minute has to be balanced. If it is imbalanced, anytime you can end up with the disease. That means functions of physiological entities like three humors, metabolic factor of Agni, tissues, anatomical consideration, excretion should be in a normal process, sense organ should perform its balance, and the mind should be always under our control, and at last our soul or Atma to be well contented. So it is not a single to say because of the microorganism, because of the invasion, it is beyond microorganism to understand for disease, and beyond that to understand for balancing for healthy individual. To say Ayurveda completely explain about holistic way of understanding health and ill health. So disease implies disequilibrium of above listed biological process. So when we go with that, 1 minute. So when we, as today's lecture is in relation to mastitis, Ayurveda call mastitis as Tanavidradi, and based on Ayurveda, I'm going to explain you what exactly the disease is all about. So udder, what we call the organ of animal which is going to affect, we call it as a stanya, where the milk is produced, and it's going to be a sub tissue of rasadhatu, that is lymph and plasma. Because that is a first dhatu, when it is in the formation, when the disease is attributing to the first dhatu, it can implies the disease to the other dhatu in systemic process. An inflammatory condition of lactiferous tissue or stanya dhatu lead to suppuration and formation of abscess is considered as Stanavidradi. That is a literal understanding about definition of the disease explained in the literature. Ashtanga Sangraha and Ashtanga Hridaya, respective chapters are mentioned here. And when we look for the causative agent, you can see these are the 6 important causative factors explained, starting from consumption of stale, excessive hot or dry foods to injury to the organ. So that means cause is not single and pathogenesis is not single, involvement of dosha, dhatu, mala, everything is going to play. Then our treatment protocol also should be multifactorial, not single. Okay. Then because of the etiology, there will be increase of physiological entity pitta. Because of vitiation of pitta, there will be loss of appetite because there will be derangement of metabolism in the body. Because of loss of appetite or intake of food, then there will be lots of toxic pro-inflammatory material is going to produce in the body. Because of that, there will be vitiation of first dhatu, rasa dhatu. When the vitiation is happening in the body, because there will be blocking of microchannels and leading to accumulation of toxic and accumulation of toxic material in lactiferous tissue, and it blocks the secretions and leading to a disease, mastitis. This is a Ayurveda way of explaining the disease pathogenesis in respect to mastitis. So when we address the disease management, our treatment protocol should be First is the etiology. Whatever the cause for the disease, it can be a management issues, it can be a genetic issue, it can be microorganism issue. That should be addressed first. Ayurveda says nidana meva chikitsa, nidana parivarjanam chikitsa. That means we need to stop the etiological factors. First, we need to address at the etiology level. Then we need to address at different levels. Next is loss of appetite. Because of vitiation of pitta in the body, there will be a loss of appetite. We need to improve the appetite of the animal so that vitiation or toxic pro-inflammatory waste will not produce. So our treatment can be at the level of etiology. Our treatment can be at the level of loss of appetite. And then the further, derangement or further, pathogenesis will not happen. So our treatment protocol should be nidana parivarjana. That means etiology should be stopped. Then comes addressing stage by stage, so that we can easily manage the disease in a better way. So when we see the Lakshana explained in Ayurveda, these are the Lakshanas told in the literatures of Ayurveda for Stanavidradi or mastitis, starting from swelling to diarrhea. It can be a complication of a mastitis, but in some of the cases of Stanavidradi or mastitis, we can see diarrhea and see varied signs and symptoms explained. Breast engorgement, pain, inflammation, unbearable pain on touch, which is called as tenderness, indigestion, lassitude, uneasiness, anorexia, arthralgia, headache, nausea, fever, thirst, retention of urine, and diarrhea. That means all explained. That means all the signs and symptoms are explained in the literature to say it is not just local changes. It is going to be a systemic changes are going to happen for individual, either a patient or animal. Then it is explained in two changes at the local changes and milk changes in the literature, signs and symptoms. Local changes can be visible for our eyes. It can be a reddish or blackish discoloration of the udder, and it can be extreme pain. Sometimes it can be a tenderness and hard and warm to touch. Then milk changes. The color of the milk varies from normal to abnormal. It can have a suspended particles in the milks too. This is the signs and symptoms explained, which is called as a local sthanika and at the kshira level. Then stages, 3 stages explained about the disease of mastitis in literature. Sama avastha, sa-ama. When ama formation is going to take place, which is called as sama avastha. Pachyamana avastha. That means when ama started metabolizing, it is called as pachyamana avastha. Then pakva avastha. Complete ama is removed, then it is going to be pakva. Vyadhi is going to pakva, complete formation of the disease. So that can be correlated for our Kala. As I mentioned, this is classified into 6 stages. The first can be first and second, Pachyamana avastha can be 3rd and 4th stage, and Pakva avastha can be 5th and 6th. Imagine if Vyadhi in Sama avastha, it can be easily reversible. If Vyadhi is Pachyamana avastha, yes, of course, manageable, also reversible. If Vyadhi is entered to Pakva avastha, then it's just a manageable, it cannot be curable. That means we need to address as possible when the Vyadhi is at Sama avastha. So very clear Lakshanas have explained for Sama, Pachimana and Pakva avastha in the literature. Based on that, the treatment protocols will be adapted. So what exactly we are doing, our treatments. So what should be our motto in addressing better outcomes is, I clearly get a 7-point understanding based on Ayurveda. First, it has to improve the status of metabolism. Whichever the animal is affected, metabolism will be deranged. So we need to address not just treating the udder, beyond the udder, we need to treat animal to improve the metabolism. Then cleanse the toxins of systemically and locally. So our approach should cleansing the toxins which are already produced because of the etiology, then locally as well as systemically. Then pacify the aggravated pitta humor and rakta, because pitta placed in rakta, so we need to pacify the aggravated pitta as well as the rakta. Then cleanse the channels of lactiferous gland. Sroto shodhana has to happen. Then cleanse the wound locally, lactiferous duct and glands. Then inflammation may be because of infection, may not be because of the infection. So we need to address treating the inflammation systemically. Then we need to reduce the microbial load if at all inflammation is because of infection. So our treatment protocol should be 7 agendas which starts from improving the status of the metabolism to decreasing the load of the microbial. So once we go with this, we can easily manage mastitis based on the principles of Ayurveda. So I'm just going to give the standard formulations which is being developed by Professor Punyamurthy, and Dr. Nair also explained 2 days back about the combination of these 3 herbs, how it's going to help. As I mentioned, 7 point, these 3 ingredients of our standard protocol for management of mastitis address all the 7. So the combination is such a way that the aloe vera, curcuma longa and calcium hydroxide, which gives externally, which improves the metabolism, which cleanses the toxins, which pacifies the humor, pitta, and which cleanses the channels, our lactiferous glands, and which also helps in wound healing or cleanses the wounds, and which reduces the microbial load as well as the inflammation, maybe because of infection or may not be because of infection. So the combination in such a way that which addresses all the 7 agendas. So when we look for each individual ingredient, how it acts based on the fire, we can easily understand aloe vera, curcuma longa and calcium hydroxide. So aloe vera, because of its bitter nature and cold potency, it pacifies the pitta, especially, and which specify all the humors. Curcuma longa is also bitter, and it also pacifies all the 3 humors, and calcium hydroxide, having the property of clearing the channels, pacifies vata and kapha. So here, being a pitta important dosha, which also involves other dosha, our main target is pitta dosha followed by other dosha. The combination help us to have better outcomes just because it specified pitta followed by other doshas. So when we look from the literature side, what Bhava Prakasha talks about the properties, you can see the 7-point agenda of treatment outcome, it covers by all 3 ingredients. See, aloe vera is a very good digestive, very good carminative. Because of digestive and carminative, it helps to overcome our, metabolic, reduction in the metabolic toxins. Similar, it pacifies because of the cold potency, it pacifies the pitta. Because of its pacifying pitta, it purifies the blood. Because its chemical activity can bring the load of microbes, and because of its Rana Shodhaka and Rana Ropaka, it cleanses the wound. Because of its anti-Shotahara property, it can reduce inflammation. So see the combination, all the 3 is having similar properties. Because of that, our drug is helping in addressing Sthana Vidradhi or mastitis based on the principles of Ayurveda. So at last, I just want to say, it's not blood, one drug, one effect. It is combination of the drug based on the rationality that the combinations have made. Based on that, the effect we're going to see, which is called as network pharmacology or Ayurveda pharmacology. One just example I'm going to give, Triphala. Many of you might be used Triphala as a laxative, but it is not just laxative, it is beyond laxative. You can see when Triphala is given with sugar, it helps in healing acid peptic disorder. When Triphala is given with hot water, it acts as a laxative. When it is given with honey, it reduces kaphaja diseases in the body. When it is given with the ghee, it reduces pittaja diseases. What it means, the combination is made in such a way that 3 herbs or myrobalance, when it is being given with the different vehicles, will lead to different action in the body, not just limiting. Same Triphala we use as a laxative, same Triphala we use with a different vehicle for treating diarrhea. That means the action of the drug vary when it combined with the other drug, when it is given with the different vehicles. That is the beauty of Ayurveda or indigenous pharmacology. So you just see this slide. Network pharmacology helps us to understand from modern point of view, when the combination has been given, will have more effect than when individual drug is given. Madam, our Santwana madam was asking this back, why the combination of herb is important rather going over a single drug or a single herb. This is a reason. You can see yellow colored is which connects to bioactives in the body. Blue color helps to bind the target sites, and red color shows the disease managed. When we give individual Triphala, that means Haritaki, Vibhitaki and Amalaki, then that is, bioactive connectivity is very less, target sites are less, and disease managed is also less. When we combine all 3 together, we can see that how effectively we can manage so many diseases. it can go so many target sites, and it can also connect with so many bioactives in the body. That shows that network pharmacology or Ayurveda pharmacology or multidimensional effect of the formulations help us to understand, have holistic outcomes rather than having individual single molecule entity based treatment, protocols. So I just want to say that is what, based on principles of Ayurveda, we also look for research in our university. So I am going to present one case study where we have used the same, formulation for prevention of mastitis during dry period. So this is the research work we carried at our university with the guidance of Professor Punyamurthy, and this is what we have taken sample size of 30 animals, milking animals, and as standard antibiotic therapy has been given standard protocol, and comparatively to that we have given Ayurveda or herbal formulation or ethno-veterinary formulation external applications of 250 grams, 50 grams and 10 grams of our calcium hydroxide, and we had a control no treatment group also. And the number of animals we are analyzed 20, but we have gone for 30. But some of dropout were there in between, so we took only 20 animals for our publication purpose and for analysis. So sample design is simple, random technique we followed, and inclusion criteria we gone with breed, crossbred, and calving status, and exclusion criteria native breeds we have not selected, and first calving and after fifth calving we have not selected. The parameter for assessment we kept is a milk, color, consistency, pH, and somatic cell count, and the nature of the udder, swelling, hard, mass, tenderness, and it is being, assessed with the help of veterinarian in the field in Bangalore Dairy. So, collection of milk for analysis on day 0 before the treatment, during the partial drying, and day 15 complete drying, and day of calving and day after calving we have gone, collection. And we have seen comparison of pH and cell counts, and between the groups, Ayurveda or ethno group and antibiotic group and control group. And you can see, I'll just go to the last slide and to say, the color of the milk was normal in partial drying in all the 3 groups to say, and average pH is less in group treated with Ayurveda and control group when compared to antibiotic treated group, and the somatic cell count is the control in higher than the other 2 groups to say. So what is the outcome of this research is almost similar to antibiotic outcomes. Our intervention ethno-veterinary or Ayurveda could able to see the results. That means it is on par with antibiotic. It is working in the field even during prevention or during dry period for prevention of mastitis. So it's not that the Ayurveda pharmacology, Ayurveda principle, it is beyond that. We are also following the modern principle for better understanding, where we are trying to bridge the gap between the Shastra and the science. So our approach is simple. Whatever the indigenous medicines explained or we have considered for applications, we go through understanding based on the principles of Ayurveda and also principles of the modern science for better understanding and for better promotion of the same recipes with the veterinarians and the farmers. So these are the references. So with this, I try to explain, a briefing about the principles and the pathogenesis and the treatment protocols based on the Ayurveda, and in very specific the mastitis understanding and mastitis management based on the principles of Ayurveda. So thank you, Indian Veterinary Association and Ayurveda Foundation for giving me an opportunity to present, on the principles of Ayurveda for disease diagnosis very specific to mastitis, and as well as disease management very specific to mastitis. Thank you.
Thank you so much, sir, for your insightful lecture on Ayurvedic understanding of disease, especially with reference to mastitis diagnosis and management. So this is a very new thing for us. As you said, the prevention is better than cure. So indigenous pharmacology, which is within the reach of the farmers, if practiced in time, it can help the farmers in managing, in preventing the disease itself. So it's very basic thing, sir, to know all the principles and the dynamics of diseases and all other pathogenesis and treatment protocols. And with a case study, sir, which is very important for us also to see the observations and to understand the impact of the Ayurvedic protocol for the animals. So thank you so much, sir, for your lecture. So if any query is there, I request the participants to ask any query, and sir, please address the queries by the participants.
I am Dr. Sudesh sir. Kumar sir, just congratulations for your excellent presentation, sir. And on this Ayurveda aspect and management of Ayurveda, just I have one query, sir. What you have suggested the treatment protocol. So, what is the outcome of that that medicine? Whether that mastitis condition cured within 1 day or 2 days or 3 days, and how much percentage it has been cured? Just I want to know that.
You mean to say you're asking about my case study, or in general you're asking, sir?
Case study, sir. Case study.
Case study, I'll just do that. Let's just rush.
Dr. Kumar, I'll take up that issue.
Ha, sir, please.
Yeah. Yeah, Dr. Kumar, that was a very good coverage of the fundamentals of Ayurveda, and particularly talking for the better understanding of the common audience on traditional Indian understanding holistically about pathobiology. And treatment is not the only way to look at it. We have to start from the scratch in approaching the whole issue. So the good presentation, Dr. Kumar. And for the question asked by the gentleman, this is actually, you see, there are so many number of combinations which could be used for mastitis treatment in the field conditions across the country. There are, you can say, hundreds of combinations are available, and there are many preparations used successfully by some field veterinarians. Like Balram Saguji is using a combination using betel leaf also, and there is Coccinia indica can be used. There are so many combinations. Aloe vera turmeric churnam was found to be a better combination based on so many parameters, based on the Siddha understanding of disease, particularly based on Matvagadams, which is a very popular livestock disease on the ancient text in Tamil. So to tell you the thing, from the year 2002, took 5 years for it to be standardized with the dose, what is being told by my colleagues in TDU, that this is a thing started with ICR. We have standardized using the antimicrobial, anti-inflammatory in vitro studies, and using information flow analysis at the top level. We have confirmed it is antimicrobial, anti-inflammatory, and also immunomodulatory potential. But if you ask for the numbers, initially it was 20-30 for ICR, and then about 100, 120 for the NDDB. Now, in the last 5 years, say from 2017 to 2022 up to now, 750,000 animals have been treated with ethno-veterinary preparations, of which 2.5 lakhs only for mastitis with the same combination, aloe vera, turmeric, and chuna. So the overall percentage of success runs around 82 to 90%, depending upon the SOPs being followed by the individual farmer at the farm gate level. Because, you know, this is a knowledge which is being disseminated with the standard operating procedures. Somehow there is a gap, and people do not apply the number of times it is used. And another important question you asked, how many days it takes the animal? If it is done at the immediately noticing the disease as a first line of intervention, within 5 days you can completely cure the disease and get back all the milk it was producing originally. We have seen all the parameters, underlying parameters, which are also coming back to normal around 7 to 10%, 10 days time. But you can see the clinical, apparently clinical recovery in about 5 to 7 days time. So that is the time duration.
Okay. Thank you, sir.
Yeah, Dr. Kumar, can you just stop the screen sharing?
Yeah, please. Yeah.
Professor Padi sir, Your
Okay,
reflection.
thank you, Dr. Bimal. Dr. Kumar made a very nice presentation. At least he made you understood the basic principles of Ayurveda, the methods of diagnosis, the principle of management of different diseases, and also showed some case studies. And later on, some other doctor from TDU clarified the position within how many days it is effective and what is the percentage of efficacy in how many animals. 80 to 90% recovery was there. And I think we had identified the common diseases. You know also better than us what are the common diseases of cattle, especially cows. And we can identify similar formulations for other observational studies also. And the papers should be published based on which our doctors and scientific community will rely. Yes, this was the observation on so number of animals, and this was the study. Dr. Gaidani was at Delhi. We had sanctioned several projects for the treatment of dogs. Some preparation made from turmeric leaves. That was also available in the form of a paste or powder like that. So similarly, this curcuma lunga, aloe vera, and this garlic, they have proved antibacterial and antiviral activities. Similarly, we can collect some other formulations for some other disease conditions. This is a very commendable work done by Dr. Kumar and his colleagues. And I think if the audience have some question, they can ask. Later on, I will explain about Bruksha Ayurveda. Dr. Chaudhary was disconnected. Actually, Bruksha Ayurveda is more connected with the BSc HG than BBSc, because you related to cattle, you see, we have two parts. One is the treatment of diseases of animals with different plants or other products. Another is treatment of several diseases and other aspects related to cow products. That is Panchagavya or other products. Though Dr. Chaudhary is an engineer, he has gone into Agni Purana mostly, and he has discovered many things and utilizing at the ground level among farmers. That is very well commendable thing. And he showed a Kunapajala, that is putrefied water consisting of cow dung and so many things. Actually, you see, in Gaon ke hafte, there is a DD News telecast in Gaon Ishe hafte ki. They had a weekly program. In that, they had shown the insecticides, pesticides prepared by some NGO at Uttar Pradesh. Out of only 5 leaves, some Nimbu, Sarifa, this Karanj, Nirgundi, that is Vitex, Nigunda, Pongamia, Pinata, Chiraita, Enterographis paniculata, and these combinations, they were boiled with the cow's urine, and after they were kept sealed underground for 40 days. Thereafter, it was recovered and filtered, and the same was considered as a solution. 1 liter was mixed with 10 liter of water. Then it was spread on the pumpkin and other vegetables. And there was almost 100% efficacy to eradicate the insects and pests. So we had also sanctioned some projects on Panchagavya. Panchagavya preparation is meant for treatment of human diseases. Delhi AIMS and some other institutes have carried out study on Panchagavya on epilepsy, cancer, and some other disease conditions. And the same is also applicable in various plant diseases, which is more concerned with the agricultural students. And that is another part, Bruksha Ayurveda, that is more relevant to agriculture. However, that is also one neglected part which should be revived. But in case of this veterinary, ethno-veterinary practices, सब बिखरा हुआ है. झारखंड में वो अपने लेवल में कर रहे हैं, राजस्थान में वो अपने लेवल में कर रहे हैं, उड़ीसा में आप अपने लेवल में कर रहे हैं. तो इसलिए आफ्टर दिस वर्ल्ड आयुर्वेद कांग्रेस, इफ all the things are collected and coordinated, I think we can yield better result, and whole animal health and human health will also be benefited. Thank you. Thank you. Thank you, Dr. Bimal. You can invite some other questions. Dr. Vaidani, you want to speak something?
Yeah, Dr. Bimal, I am Dr. Gaidani here. By listening the excellent presentation of Dr. Kumar, what I am thinking that all interested veterinarians has to be join the certificate course on Ayurveda to understand the veterinary Ayurveda and Ayurvedic management and other aspects also. Simultaneously, this Ayurvedic doctors also has to be go for the training for certificate course for the veterinary health related aspects, so that we can achieve this goal. What I think, sir.
Yes, sir. Yeah, you have rightly told. We have one course called the ethno-veterinary practice that is provided by Tanuvas, and also the organization of Professor Punyamurthy, that Glow Shiva, his organization is also providing courses where actually, Ayurveda doctors can come and take the courses of this ethno-veterinary practice and they can know the disease. But I don't think there are some courses for the veterinarians they can take as a certificate course. Maybe you can develop some diploma or PG diploma courses in veterinary, in Ayurveda, where the veterinarians can join.
Bimal, to address this, yes,
Yeah.
TDU along with the Punyamurthy sir's organization, we are planning to go for diploma course and PG diploma course, Pashu Ayurveda and ethno practices together. And already we are having certificate program on ethno-veterinary practices, and we have trained nearly 2,000 veterinarians across India. So
Yes, sir.
even
I am not. My point is, sir. My point is to to know the Ayurveda part.
Yes, we are planning to launch. We need support from Indian Veterinary Association. We need support from Ministry of Ayush. Like Paddy sir has to help us to have and other Gadian sir to help us, so that we will launch through ministry itself. TDU can be a technical partner in going ahead with these type of programs.
Definitely will help.
Okay, Dr. Sahab.
Yes. Agreed.
Actually, it should be combined. It should be integrated. Because ethno-veterinary practices and Ayurvedic descriptions are mostly similar. May not be 100% same, mostly similar. So when they are being trained with ethno-veterinary practices, if simultaneously we make them understand about Ayurvedic principles and what are described in our texts also, it may be available in regional level or translation with Hindi or English. I think both can be combined together. If you give separate certificate course, then it will be very difficult on the part of veterinary to go on leave and to take such a course. So I think if it is my suggestion, you can all decide if ethno-veterinary practices and Ayurveda, veterinary Ayurveda can be combined and a certificate course is given by your university. I think that will be better.
That will be better.
Yes.
Sure, sir. We are working on that combined with Pashu Ayurveda as well as ethno-veterinary practices. We are developing on that. We'll approach you people, Madan sir.
Yes, sir. Yes,
so we'll work together, sir.
Definitely, I am ready to help, and Dr. Gaidani is also there. So please, we will help you in to whatever extent possible by us. So please develop a course, and we will help you.
During this World Ayurveda Congress at Goa, I think we can discuss some primary phase with this certificate course, and that
we have one day exclusive session on Pashu Ayurveda on 10th December. Either prior a day or after a day, we will have a small meeting and we will discuss on that, sir.
Yes. This can be recommended to Ministry of Ayush, to ICAR, and Department of Animal Husbandry. I think they all should take a combined action, and that will be better, I think. And you have already at university. You are free enough to design a course and to start. I think that will also helpful. That will also be helpful. We will also recommend for a scientific validation and a publication of all the available manuscripts in different repositories or libraries with English translation preferably, so that it is understood by all our BBSc students and can be referred at time for need. Thank you, Dr. Sir.
Thank you, sir. Thank you so much for your support.
Thank you, sir. Thank you.
In fact, today with us is Dr. Teresa Rosenberg. She is there. Rosenberg is the director of Rosenberg European Academy of Ayurveda. They have developed some courses on animal Ayurveda, but basically that is for the management type. And we need some courses purely on diseases. I think TDU can take that part also.
Yes, thanks. Yes, I'm here. So I think we have 2 points you already told. We have the veterinarians, which can be taught in the Ayurvedic treatments, and we have also the Ayurvedic doctors, which can be treated in the veterinarians. I think to be treated in the veterinarian science, it is not so easy. So of course, the Ayurvedic, yes, the Ayurvedic principles, they are really common, and we just can use it for every animal, but we really have to see which part and which drug we can use. You know, there are a lot of drugs we can't use for cats and dogs, or sometimes also horses, because it isn't working really healthy. Sometimes the the Ayurvedic doctors don't know how much they have to give and which are the anupanas for the animals we can use. So here there is a huge amount of knowledge they have to be trained. I think it will be easier to train the veterinarians, because they know for every for every animal which physiologically they have to use here, which nutrition and also which drugs they can use. They know the anupanas, which will be healthy and which will be great for the cycle, or maybe also the body of the animal. And so in our program we are teaching both, but for the Ayurvedic part, we have a huge amount of Ayurvedic basic knowledge we are teaching the vets, and so I see this is quite easier to teach the Ayurvedic part in the animal. We also see that there I'm just I'm looking that they're using more the nutrition part, the ahara and vihara, and be careful with the most of the drugs. And also the there we can see there are some. I think it is so important, because also for the veterinary. So now I was silent. I think you hear me again, isn't it? Yes. So I think what we can really say is that for the veterinarians, Ayurvedic treatment is a really chance, because here in our country we see that the Ayurvedic treatment can be done when we don't know what the disease is. So the Ayurvedic diagnosis is just one part, and we have a lot of diseases we can't really treat it in the modern way, and here we have a really good chance to get it treated with the Ayurvedic treatment. So I think on both ways, the veterinary Ayurvedic science can be a really good chance for the healthiness of our animals.
मच्छर काट रहा मुझे बहुत सारे ब्रैकेट है मेरे मुंह पे खा गए ब्रैकेट दो मेरे पास ना है
Yeah, thank you. Any more questions?
Yes, sir. I have one query. Can I ask, sir?
Yes, go ahead. You are the master of ceremony today.
Madam, you are not audible.
Dr. Nivedita, you are not audible.
She has lost her connection, it seems. Yeah, she's back.
Okay. I think she is joined. Okay.
Yeah. Sorry for the question, sir. Actually, sir, my question is, we are giving some phytogenic feed additives in combination, suppose different ingredients to the birds in the growing phase, then in laying phase, to see the effect of these ingredients on the growth, immunity, and gut microbiome, metabolism, and in the dinner egg production, enriching the nutrient content of eggs. So, sir, I want to know how the networking pharmacology, that network pharmacology is show in one slide, can be applied here in this part, and how we can do that, the connection and networking between the different active ingredients of different phytogenic additives.
Madam, your question is on network pharmacology. How your feed additive can be go with network pharmacology understanding.
Yes, sir.
So network pharmacology is based on what I can say, computer aided technology used for that. When we have a standardizing the herb, the ingredient of your feed additive should be standardized first for that software application. Then only we can see the network pharmacology of those ingredients.
Yes, sir.
Because see, it is not done for every herb. It is ongoing process they are doing, and with the team from Symbiosis University of Pune, along with the TDU, they are working on that, developing a network pharmacology principle to identify through software-based, studies to know for or to standardize each herb for its bioactive ligand binding, and then going for disease management through high throughput screening process. So once the herb of your ingredient is standardized, then the combination of the same can be done. For example, in case of Triphala, first we have to standardize for 3 plants, fruits. That is our Amalaki, Haritaki, and Vibhitaki. Then the combination has to put together to know that how it's going to work on the rationality of combination of formulation.
Yes, sir.
I hope I answered your question.
Yes, sir. For that standardization of bioactive ingredients, I worked with Dr. Shantona ma'am. So we have analyzed 2 different techniques like chromatography and spectroscopy techniques, and they standardize the bio ingredients like through FTIR and IAS. So, but that we have given in biological experiment in poultry, but that we want to add that thing, sir. Now we got idea from your slides that network pharmacology. So you will take your help, sir, in this regard.
Sure, ma'am. Sure. We'll work on that.
Yes, sir. Thank you so much, sir.
Thank you.
I have one question to Sri Ravi Singh Chaudhary, sir. Sir Ravi, sir, are you there?
Yes, Bimal, sir.
Yes. So you have, being an engineer, you have explored a lot. How you see the cow, how the people are seeing the cow as today and the perception in the ancient days. What is the difference?
Okay, so revolution is what? White revolution. So Indian cow generally don't give like white milk. Okay, and the model is not based on like in Western country milk and meat model. Okay, either you can use humanity factor or the religion. We do not trade, means the dairy farmer in general, at least legally, don't trade in meat. Okay, so when we see cow as a machine, a milching machine, it's a kind of a 50% your value chain or 50% of the complete business model. Okay, so what is the indigenous model? You have to use cow urine and cow dung also in the process, in the value addition or in the value chain. Okay, so cow is the basis of not just as a food, having a milk with calcium. It is also the basis of Ayurveda, also the basis of naturopathy. Okay, so the milk trading, there is no kind of a history in even in ancient time. Like हम लोग कहते हैं ना कि गंगा मतलब दूध की नदियां बहती थी, तो नदियां बह रही हैं. If it is a river of milk, it is not a tradable quantity. Okay, ghee was traded. Okay, cow urine was traded, but not the milk, which has a very low perishable life, and you have to use chillers, and you have to use the pasteurization techniques. So in India, we see cow as a mother, which takes care of our health, which takes care of our the basic nutrition of even the child. We know, like, the cow's milk is much more similar to the mother's milk. Okay, so cow is the basis of our, basically, the agricultural civilization. And you see, when we talk about sustainability, we immediately go for, like, we have to go for integrated farming, we have to go for low food carbon techniques. So fertilizers, chemicals, those are made of crude oil, and they are transported. So 1 calorie of food is being produced by using 10 calorie of inputs. Okay, it is being manufactured somewhere else, then transported, then stored, then distributed. And what is the indigenous model? Local based economy, biomass energy based model. Okay, it is eating your weeds, and within 1 day it is giving you the cow dung. Even the vermicompost takes more than 50 to 60 days in preparation. So uh, cow lowers our energy demands, lowers our carbon footprints, take cares of our health. So many of the dimensions or the laterals you can see from cow, it is coming, and it is not just a milking machine. So in that sense, we can see the Bos indicus desi cow.
Thank you. Any more questions to our speakers?
Actually, Dr. Bimal, I want to speak few words on what you asked to Dr. Chaudhary. Actually, you see, due to our population explosion and to meet the demand of milk, we have gone into this hybridization of cows, Jersey or mixed Sankar. Then we are meeting the need of the food. But now there is a great debate between the indigenous cows and this hybrid cows. The indigenous cow's milk contain A2 protein, which is antioxidant, anti-carcinogenic, and has a lot of health benefits, which is not present in your Sankar or Jersey cows. So many gosalas and some organizations are exclusively working on cow products, especially Gomutra Orgs, Selekar, वो पंचगव्य और now they are utilizing this not only for medicine but also so many domestic care products like soap, agarbatti, your other cosmetic creams are also made, face wash, facial cream, and many other domestic products, cosmetic products are also being prepared. In 2015, we conducted one seminar at our CCRS headquarters, New Delhi. Dr. Gaidani was instrumental for that seminar. We convened so many persons from different gosalas, beginning from Nagpur to Mathura, from almost all over India. So many persons come from gosalas. You know, the Nagpur gosala, they have got some US patent for cow urine concentrate and some other medicinal products out of that. And in Tamil Nadu, we invited one person who could not attend our seminar but shared his presentation. His qualification is MBBS, but he is applying. He has been applying this Panchagavya products. Panchagavya, you know very well. This milk, curd, and urine, dung, juice of dung, all this ghee, all these 5 products. And he was utilizing these Panchagavya products not only for the treatment of tumor and cancer and other diseases of human beings. He was also applying it in the diseases of nariyal, coconut. You know, this coconut is infected with some type of infection. It is discolored, like fungal infection. And he was utilizing the same for fisheries, for the diseases of fish, especially this muddy fish who are getting some skin cancer like disease. He was treating those, and he was treating animals, animal diseases with Panchagavya. He was treating human diseases with Panchakarma. So now the scope of cow products are wide, and people, but they are segregated. They have no coordination. He is MBBS doctor. He is practicing in all sector. Your cow joins cow urine therapy in Indore. He is treating almost so many critical and chronic diseases with this cow urine product, either in a capsule form or in a liquid form. So what Dr. Chaudhary has done a very commendable thing for Burkha Ayurveda, which is more helpful for plant diseases and to develop some insecticides and pesticides out of cow products. I think that will be nice to integrate with them also. So that will also explore both for the diseases of animals, plants, and humans. Thank you. Thank you. That's all.
Yes, sir. In fact, a few years back, Government of India started one project called as RGM, Rashtriya Gokul Mission. Under that, we are actually promoting, our local indigenous registered breed, like Gir, Sahiwal. In Orissa, there is a breed called as Binjarpuri. This type of breeds we are actually promoting. And as you mentioned, the regarding, yes, sir.
Yes, in Odisha, I think 4 varieties of indigenous cows are there. Ghumsari,
yes,
in Jajpur, in Kalahandi side, Ganjam side. Similarly, I think 34 or below 40 varieties of are there. Better varieties are Gir and your Dhariwalia, something Madhya Pradesh, Gujarat, Haryana. They are better breeds. So that is another question of debate. But first, we work on Pasu Ayurveda, then go for other aspects. That is better, I think.
Yes, sir. You will be happy to know, there is a national genetics board. There is a organization, ICR. They are working on our Chilica buffalo, and their milk is now there. Dr. Daige is working on it. He's saying that, his milk can cure the cancer. The research.
Yes. It is now moving in a WhatsApp group and TV channel also. That buffalo of Chilica milk can cure cancer. But may not cure, but may be helpful in carcinogenic conditions.
Yeah, it was registered as a registered breed by our professor, Dr. Sushant Das. He is a professor of our genetics department. Because nobody has seen that as a registered breed. Just 6 to 7 years back, he has registered that one. So in fact, we can see a lot more new innovations in our this Pasu Ayurveda, and we hope to see all of you in our Goa conference that is going to be held on 10th December. So I think Kumar can speak for a few more words on our conclave.
Okay.
Yeah. In fact, tomorrow we have a concluding session, and we know it's a very short duration. We have conducted a 5-day session with 10 speakers, and tomorrow there is a panel discussion at 7 p.m. and 7 to 7:45. The panel discussion will be there with our 5 to 5 eminent panelists are there, and it will be chaired by our Padma Shri Professor M.L. Madan sir. He was ex-vice chancellor of our Akola Veterinary University, and it will be moderated by Dr. M. Barbarua. He is a director of Vet Helpline and also the trainer of OI. And after this session, we will have a concluding session. In the concluding session, professors and practitioners from veterinary, pharmacy, and our WHO and our FAO, the persons are going to join, and we will conclude it by 8:30. And one important announcement that during this validity session, we have invited a person who will speak about the Gaja Ayurveda. He will speak in Malayali, but it will be translated by Professor M.N.V. Nair sir in English. So you can interact with him because his family is practicing it since long. Thank you all. And at the end, I would like to thank our moderator, Dr. Nivedita Nayak, and our speakers, Dr. S. Kumar, Engineer Sri Ravi Singh Chaudhary, and our chairman of our session, Professor Madan Mohan Padi sir, Punyamurthy sir, Dr. Theresa, and everyone. Thank you. Thank you all.
Thank you to all. Thank you.
Thank you all. Thank you so much. See you all again tomorrow. Thank you all. The valedictory function.
Okay.